This paper looks at how the use of eyeglasses may reduce the risk for COVID infection. So, this study looked to test the hypothesis that wearing eyeglasses is associated with a lower risk for COVID. This was a UK study that looked at community cohort responses to a survey on the use of eyeglasses and contact lenses. Infection was confirmed through the data linkage program and self reported positive results. And for a subgroup of those patients, it was confirmed through monthly capillary antibody testing. Around 19,000 participants responded to the questionnaire, and about 14,000 had eyeglasses. Running the stats on this, they found a 15% reduction in risk for those that always wore eyeglasses for general use compared to those who never wore eyeglasses. Where their conclusion is that people who wear eyeglasses have a moderate reduction in COVID risk for COVID infection, and the authors suggest that eye protection may be a valuable contribution to the reduction of transmission in community and healthcare settings. Currently, recommendations for the general public in most countries include social distancing, hand washing, and face mask use, but not eye protection, where regular corrective eyeglasses are not considered eye protection. However, eyeglasses may provide a barrier to prevent exposure to infectious aerosol particles, particularly the ballistic component of larger particles like droplets, and they also may indirectly reduce the frequency of contaminated fingers touching the eyes. In their study, among those who never wore eyeglasses for general use, about 23% were infected versus about 16% who always wore glasses. And they ran an odds ratio on the frequency of use for those that never wore glasses being the control point, which is why the value for that is 1, because that's what the frequency is being divided by. So for general use, again, those that always wear their glasses had about a 15 point reduction, 50% reduction. And this held up for those that use glasses for other reasons besides general use and for reading, even. But interestingly, this did not hold up for contact lenses, where it's actually trending to be more likely to be infected if you're wearing contact lenses than if you never wear glasses or contact lenses. But this isn't statistically significantly different because that standard error goes across. So you can only say that it trends higher, not that there's a causal relationship. So the results show a significant reduction in the odds of COVID-19 infection among those that always wear eyeglasses, demonstrating the importance of the eyes as a portal for infection and suggest that strategies to broaden the use of eye protection could help prevent transmission and contribute to infection control. And also, since they looked at contact lenses and saw that there was no protective effect, this strongly suggests a causal relationship between eyeglass wearing and reduced risk of COVID infection. Another interesting point of this study is that many individuals will actually reduce mask wearing with eyeglasses because of their eyeglasses steaming up, which is associated with a reduced protective effect. So if we go from strongly disagree to strongly agree with this statement, I am less likely to wear a face covering when I have my glasses because my glasses steam up. Those that strongly agree have a much higher odds ratio of getting infected with COVID than those that disagree with that statement. And interestingly, the trend is tiered. And of note, healthy individuals involuntarily touch their eyes around 3 times per hour, and indirectly wearing glasses may reduce the number of times that someone touches their fingers to their eyes, which would decrease the likelihood of accidentally transferring COVID from your hands to your eyes through fomite transfer. And while it wasn't looked at in this study, they hypothesized that even greater protection against COVID may be afforded by eye protection that wraps around the eyes, so eye safety glasses or goggles, in addition to face shields. And they can't go that far because they didn't look at this in the study, but that is a pretty strong hypothesis, in my opinion, with one of the major findings being that even simple glasses like these without the side protection can offer protection against COVID, and that the more dorky glasses like these ones can provide even more enhanced protection if they have side shields.